This is Dr. Beth Dineen. For this episode, we're joined by Doctors Erica Schorr and Adam Gepner, Chair and Vice Chair, respectively, of the American Heart Association Scientific Statement, Harnessing Mobile Health Technology for Secondary Cardiovascular Disease Prevention in Older Adults. Dr. Gepner is a physician scientist with a dual appointment at the University of Wisconsin School of Medicine and Public Health and the William S. Middleton Memorial VA Hospital in Madison, Wisconsin. Dr. Schorr is an associate professor in the School of Nursing at the University of Minnesota in Minneapolis. Dr. Schorr is lead author of the scientific statement. What do you see as some take-home messages?
I think one thing to keep in mind, although the technology continues to change, to use whatever apps or devices you have. Don't worry about getting the latest and the greatest. To use what you have to support the health goals that you and your provider have developed. If you already have established cardiovascular disease, then you can try to reduce your risk factors for having a subsequent cardiovascular event and you're having your disease progress, and for individuals who haven't been diagnosed with cardiovascular disease to prevent the development from happening. We know that people are largely sedentary, and so these types of devices in our experience have motivated people to move more and sit less and take the medications that they need to stay healthy. The first step to increasing patient use and engagement is to have a conversation and assess each one of your patients individually, the same way that we would perform any other health assessment. So before making any specific recommendations, you would want to know what mobile technology your patient currently owns and if they're using any of those technologies to monitor their health. So for example, to track their sleep or their physical activity, perhaps the blood pressure or blood sugar, and even for medication reminders. So then based on the patient's use of technology and their current health status, then you can create shared goals and then leverage the mobile technologies to really assist patients to monitor their health, prompt them and encourage them to make those healthy behavior changes, especially for individuals who might be prone to adverse events such as polypharmacy, other comorbid conditions. And as we've mentioned before, it's really important for us as providers to avoid this common misconception that older adults wouldn't own mobile technology or that they don't have the skills or the interest in using mobile technologies to optimize their health.